At this time, I will call to order the meeting of the Assembly Committee on Health and Human Services today. I'm very excited to be here in our committee room. This is our first in-person meeting, so welcome to Health and Human Services. Madam Secretary, if you would call the roll, and if I can remind members to push your microphone when you say here.
Assemblywoman Benitez Thompson. Assemblywoman Black.
Here.
Assemblywoman Gorlow.
Here.
Assemblyman Hafen.
Here.
Assemblywoman Krasner.
Here.
Assemblyman Matthews.
Here.
Assemblyman Orentlicker. Assemblywoman Peters. Assemblywoman Summers Armstrong.
Here.
Assemblywoman Thomas.
Here.
Assemblywoman Titus.
Here.
Chair Wynn.
Here. We do have a quorum present. I will ask our wonderful staff to mark members present as they arrive. I know that Assemblyman Orentlicker, Assemblywoman Benitez Thompson, and Assemblywoman Peters are all presenting in other committees in the Senate right now, so it is that time of the session. Again, I would welcome the people that are here present in the room, as well as the people joining us virtually to this committee hearing. Today we have 3 bills and just several housekeeping things. If you are on the Zoom, please mute yourself, and I'll remind our people presenting to unmute yourself when you begin presenting, as well as to clearly state your name for the record when you speak. I know it is not a natural habit to do, and we will try to remind you when at all possible to do so. And with that, I will start our hearing and open up the hearing on our Senate Bill 364. And if we can call Senator Scheibel up to our witness table and to begin when you're ready.
Thank you so much, Chair Wynn and committee members. It is wonderful to be here and to be in person. I'm Melanie Scheibel for the record. I represent Senate District 9 in Clark County, and I'm here to present Senate Bill 364 for your consideration. Throughout the nation, many emergency medical care facilities do not offer victims of sexual assault the treatment necessary to prevent pregnancy, and some even fail to inform victims that it is an option, even though emergency contraceptives are readily available. Emergency contraception can prevent pregnancy if taken shortly after unprotected sex or a sexual assault. Of the 4 FDA-approved products on the market, 3 are approved to prevent pregnancy if taken within 72 hours, and 1 has been available over the counter since 2013. Medical facilities' failure to offer and provide emergency contraception means victims of sexual assault are at risk of becoming pregnant through no fault of their own. Senate Bill 364 aims to ensure that victims of sexual assault here in Nevada are informed about and have access to this necessary treatment. It requires a State Board of Health to adopt regulations requiring hospitals and independent centers for emergency medical care to provide training to individuals who provide care to victims of sexual assault and attempted sexual assaults. In addition, hospitals and independent emergency medical centers that treat victims of sexual assault or attempted sexual assault must inform those victims of their right to receive emergency contraceptive and provide all doses of such contraception upon request. At least 19 states and the District of Columbia all have similar laws, and the American College of Obstetricians and Gynecologists, OBGYNs, and the American Public Health Association recommend that victims of sexual assault be informed about and offered emergency contraceptive. I am happy to report that all of the hospitals in Nevada that I talked to are supportive of this bill and are already engaging in this practice. The reason to bring the bill is not to point fingers at bad actors or to suggest that there are Nevada hospitals and medical providers who are not adequately caring for victims and survivors of sexual assault. But we know that sexual assault is an incredibly personal and sensitive subject, and there are women in Nevada who report not having access to emergency contraceptives at the time of their assault. Whether that's because they didn't go to a Nevada hospital or because they went to a Nevada hospital 5 or 10 years ago before the policies changed, I just don't see any reason that we shouldn't be putting into law this kind of provision that is supported by the hospital associations and all of the medical providers that I spoke with to ensure that today and every day into the future, anybody who reports to a Nevada facility, be it a hospital, emergency room, or other place where emergency care is provided, be offered and provided with the emergency contraception that they need and that they're entitled to receive if they are the victim of a sexual assault. I'm happy to answer any questions you might have about SB 364, and I urge your support. I also believe, I was supposed to do my due diligence and check and see if my co-presenters had signed in on Zoom or not, but I do have Caroline Mello-Roberson available to answer questions if she is here. Or we might have had a miscommunication and she might not be here, and that would be my fault. But I will relay any of your questions to her.
1 second, Senator Scheibel. We'll see if she is on the Zoom or on our call. Do not see her on the Zoom or on the call. If she does call in, I'm sure if there are questions that directed to her, she will be able to say that in support. Otherwise, we will have you pass on any concerns or ask members to reach out to her directly. Do we have any questions from committee members? I see one from Assemblywoman Titus. Go ahead.
Thank you, Madam Chair, and thank you, Senator Scheibel, for bringing this bill forward and championing it all the way through on both sides. Just a question regarding your statement that you made in the opening that this requirement affects anybody, all facilities that offer emergency medical care. Having had a clinic that was 30 miles away from anything else, I didn't have an emergency room, didn't advertise it as an emergency room, was simply a family practice office, and certainly did women physicals, et cetera. But occasionally we had a walk-in emergency, a carry-in emergency, or other thing come to my office. Just wanted clarification, would this affect then every private office that somebody might walk in with an emergency, or it has to have that designation of either a freestanding urgent care? Are you talking about urgent care centers and emergency centers, or are you talking about anybody who might see somebody on an emergency basis?
Thank you, Melanie Scheibel, for the record. And this would, by law, be limited to just emergency care providers. I think the best way that I was able to think about it, conversing with LCB, is any place that a SANE exam might be conducted is the kind of place that provides emergency care to somebody who is a victim of sexual assault. Although sometimes we see that the problem derives from somebody going first to an emergency room and then transferring to a different center for their sexual assault exam. But I also think it's important to point out that the hope here is that medical providers would all want to be doing this and would want to be providing people with that kind of care, and it applies specifically to emergency rooms and emergency care providers.
Thank you, Madam Chair, for the question.
Do we have any other questions from committee members? I will go next to Assemblywoman Thomas.
Thank you, Madam Chair, and thank you, Senator, for bringing this bill forward. I think that it really is necessary, since I was an advocate, a volunteer advocate at the Rape Crisis Center. So I was wondering, with that said, generally we have that rape hotline, and we're told to send victims to the UMC. So I thought it was a standard practice when they went through UMC to be able to offer this. If you could explain that and how this bill would ensure that those victims, if they're not sent to UMC, to other emergency rooms, would help. Thank you.
Thank you, Melanie Scheibel, for the record. And you are correct. This is UMC standard practice. This is also standard practice throughout the Las Vegas Valley and in other parts of Nevada. And so the purpose of putting this into law is to make that uniform across the state now and into the future. And so one of the ways that we might see this law affecting people in real life is that people on the crisis call hotline would now be able to tell victims, whatever hospital you go to, you are entitled to receive an emergency contraceptive. So if they don't offer it to you, ask. And if they don't offer it to you, they're in violation of the law. You have the right to ask for it. And then they'll be able to point to the statute so that every person who wants and needs emergency contraceptive has the power of the law behind them to request it and be entitled to it.
Thank you. That's great. And thank you, Madam Chair.
Thank you. And just for clarification for Assemblywoman Titus, both of the terms as defined of hospital and independent center for emergency care are already specifically defined in Chapter 449. Next, I'll go to Assemblywoman Summers Armstrong.
Thank you, Madam Chair, and thank you, Senator Scheibel. It's lovely to see you, and thank you for the presentation. I have a very small screen, and so I can't have multiple things up, but if you could just go into the bill at the top says there could be a fiscal note. Could you please explain to us what that might be? Because my question would be about cost for these facilities, how they would be reimbursed, if that would be through Medicaid or Medicare, or just if you can just go into that a little bit.
Absolutely. Melanie Scheibel for the record. Thank you for the question. I'm happy to report that the fiscal note is 0 across the board. I think it was completely appropriate that when this bill was drafted, it was flagged as a possible fiscal note. If this was something that our state-run hospitals were not already doing or something Medicaid was not already covering, then it would have in fact caused an increase in cost to the state. However, since all of the facilities here in Nevada are already up to par with this policy, there's no additional cost involved in ensuring that it's uniform across the state.
Go ahead and follow up.
Thank you. So you did mention specifically public facilities. We do have private hospitals. If you could sort of elaborate on how this would affect them. Are they on board? Are they expecting this to change their bottom line at all? I just think it requires same. Thank you.
Thank you. Melanie Scheibel for the record, and yes, this would also affect private hospitals. They would also have to provide survivors of sexual assault with the choice to get emergency contraceptive and then that emergency contraceptive if so requested. And all of the hospitals that I talked to are on board. The Dignity Health Center or the Dignity Health family of hospitals, St. Rose Dominican, Southern Hills are all on board, and I have not received any opposition. Of course, always, if there is, I'm happy to talk to those people and work through this with them. I hope they won't mind me sharing. I won't say who it was, but one hospital did reach out to me and said, oh no, I hope this wasn't our facility. Was this us? Because they all really want to comply with this standard, and I think that they already do.
Do we have any other questions before I go to testimony in support, opposition, and neutral? Seeing none, I don't see anyone in the room. Do we have anyone on Zoom to testify in support of Senate Bill 364? Broadcast services?
To testify in support of Senate Bill 364, please press *9 now to raise your hand. Caller with the last 3 digits, 199. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Thank you, Chair and members of the committee. For the record, my name is Tess Opferman, that's spelled O-P-F-E-R-M-A-N, speaking on behalf of the Nevada Women's Lobby. This is an incredibly important bill which makes it easier and more accessible for victims of sexual assault to access emergency contraception. Emergency contraception is not an abortion. Emergency contraception prevents a pregnancy from taking place and is most effective when taken within 24 hours of the unplanned sexual encounter. Victims of sexual assault have faced an intense trauma, and there are a number of things they must do after the encounter, which could include the filing of police reports, taking drugs to prevent STDs, and taking emergency contraception or Plan B to prevent pregnancy. The Nevada Women's Lobby is supportive of any measure that can be taken to help make this process easier. This bill, SB 364, requires hospitals and emergency medical centers to have available emergency contraception so that women dealing with an assault can get necessary medicine quickly and easily without needing to go to a second location. This is an important measure that will help alleviate, ever so slightly, an awful situation. Thank you so much, Senator Scheibel, for your work on this legislation. We thank you for your time on this bill, and we urge your support today. Thank you so much.
Thank you. We can go to our next caller in support.
Caller with the last 3 digits, 729. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Hi, this is Caroline Mello-Robertson for the record from NARAL Pro-Choice Nevada. I am proud to testify in support of SB 364, Senator Scheibel's legislation to require Nevada emergency rooms to make emergency contraception available to survivors of sexual assault. NARAL is a nonprofit advocacy organization dedicated to advancing reproductive freedom for everybody through policy, political, and community organizing. NARAL organizes across the state through things like virtual meetups, phone banks, online actions, and community events. We have more than 44,000 battle-born feminist strong members, and we're growing every day. SB 364 is a continuation of the successful 2019 effort led by former Assemblywoman Connie Monk to require Nevada hospitals to provide survivors with information on where they can access emergency contraception. Emergency contraception is a safe and effective way to prevent pregnancy. It does not end a pregnancy. There are a few types of FDA-approved emergency contraceptives, including the copper IUD, and 2 types of birth control pills, that are commonly referred to as the morning after pill. Depending on the pill, it can be effective if taken within 3 to 5 days of unprotected sex. Emergency rooms often serve as an entry point into the healthcare system for people who have been sexually assaulted. It is essential that emergency rooms provide access to time-sensitive emergency contraception for survivors of sexual assault. Survivors should not need to delay their care while they seek this care from other providers, and there are many who may not be able to see their primary care doctor for the care they need. And timing is really important. According to MurderWatch.org, an estimated 25,000 women in the United States become pregnant as a result of sexual assault each year, and statistics suggest that 22,000 of those pregnancies could have been prevented if sexual assault victims had timely access to emergency contraception. Everybody must be able to decide for themselves if, when, how, and with whom to have a child, which is why NARAL is advocating this session to ensure survivors are able to access this time-sensitive care as soon as possible. SB 364 is a critical step towards breaking barriers down to and ensuring we can all live in a freer Nevada that works for everybody. Nevadans are proud to live in a state with a long history of trusting women making their own personal healthcare decisions. With this bill, the Silver State can continue to live out our values. We urge the members of this committee to vote in favor of SB 364. Thank you so much.
Thank you. And it turns out she was on the line. If we can go to our next caller in support.
Caller with the last 3 digits, 540. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good afternoon, Chair Wynn, members of the committee. For the record, my name is Serena Evans, SERENAEVANS, and I'm the policy specialist with the Nevada Coalition to End Domestic and Sexual Violence. During the 2019 legislative session, NCEDSB worked with Assemblywoman Connie Monk on her legislation, which, among other things, established the provisions that are in this bill. Unfortunately, the piece around emergency contraception was eventually amended out of the bill, and so we're so grateful for Caroline with NARAL Pro-Choice and Senator Scheibel for bringing this important matter back this session. Excuse me. To give some context of why this bill is so important, I want to share some information with you. Outside of my capacity at the Coalition, I also volunteer as a sexual assault advocate here in Washoe County. The Washoe County Sane Medical Facility is not at the hospital and is rather in a different location altogether. This facility also conducts SANE exams for all of Washoe County and many of the northern Nevada rural communities. The majority of the victim survivors that I see and work with, the first response after being sexually assaulted is to go straight to the emergency room to seek medical care. And they do not want to report to law enforcement. And what they want most is care and emergency contraception. Choosing to undergo the SANE exam, engagement with law enforcement, and receiving emergency contraception are and should be separate decisions, and it is so important that victim survivors are treated with compassion and given access to emergency contraception, whether or not they choose to submit themselves to a SANE exam and engagement with law enforcement. Especially for our rural communities, having to travel hours to a SANE location when all they really wanted was emergency contraception is not a victim-centered approach. All hospitals should have emergency contraception on hand and should dispense the medication when requested by the victim survivors. This bill is a great step in reducing the barriers that many victim survivors face throughout Nevada, and we thank you for your time.
Thank you. If we can go, I think that was our last caller, but just to make sure, do we have any other callers on the line in support?
Chair, there are no more callers on the line for it.
Thank you. Do we have any callers in opposition on the line?
To testify in opposition to Senate Bill 364, please press *9 now to take your place in the queue. Chair, there are no callers in opposition at this time.
And do we have any callers in neutral?
To testify in neutral to Senate Bill 364, please press *9 now to take your place in the queue. Chair, there are also no callers in neutral at this time.
Thank you. And with that, I will turn this back over to Senator Scheibel for any closing remarks.
I just want to thank the committee for your time, and if you have any further questions, please don't hesitate to contact me.
Thank you. And with that, I will close the hearing on Senate Bill 364. And at this time, I will now open the hearing on Senate Bill 123. This bill revises provisions related to the Nevada Silver-Haired Legislative Forum. I see Senator Spearman on the Zoom. Please begin when you are ready.
Thank you, Madam Chair. To you and to the committee members, thank you first of all for giving me this opportunity. This is a really simple bill, and I'll tell you that it came about a couple years ago when I appointed a very prominent member in our community, in my district, to the Silver-Haired Forum, and was told at that time, because she had not lived in Nevada for 5 years, she was ineligible. And I'm like, you're kidding me, right? No, she's ineligible. The law says that she has to live here for 5 years. And this was someone who had retired from a major corporation and had a lot of insight into some of the things that I know we're trying to do for seniors. So that's why I brought this bill. 1997 legislature created the Nevada Silver-Haired Legislative Forum to identify and act upon issues of importance to aging persons. Its membership, powers, and duties are codified in revised statutes 427A.320 through 427A.400. The forum is comprised of members equal to the number of state senators, and that's 21, who, among other requisite qualifications, must have been a registered voter for 3 years preceding their appointment in the senatorial district of the senator who nominates them from an appointment. In addition, members must have been a resident of the state of Nevada for 5 years. Members of the National Silver-Haired Congress from Nevada serve as ex officio members of the forum. Nevada currently has 2 silver senators and 3 silver representatives. Section 1 of the bill revises the qualifications for appointment to the forum by reducing the requirement for the state residency from 5 years to 1 year or 6 months if the nominee is a member of the military, and reducing the requirement for residency in the senatorial district from 3 years to 30 days. Section 2 revises qualifications for a member of the Congress who is an ex officio member of the forum to vote by reducing the requirement for residency in this state from 5 years to 1 year or 6 months if the ex officio member is a member of the military. The changes proposed in this measure will expand the number of individuals who may be nominated by an appointing senator to serve on the forum. It will also give greater flexibility to appoint individuals who may be members of the military. And finally, the measure will expand participation by members of the Silver Congress. Madam Chair, let me say this. The 5-year requirement for someone who is going to serve with no pay, basically a volunteer to help us try to solve some of the issues that are facing our seasoned citizens, didn't make sense to me. And I think that when we limit the number or the qualifications that people must have, when we say it's got to be 5 years, it's got to be 10 years, well, we've got things that need to be solved this year. We have things that need to be solved in the next 6 months. So this bill really affords an opportunity for those who are otherwise qualified to serve, to be appointed to the Silver-Haired Legislative Forum. And with that, I will answer questions.
Thank you, Senator Spearman. Do we have any questions? Oh, it looks like we have Assemblywoman Titus. Go ahead.
Thank you, Madam Chair. And actually, it's a comment. Senator Spearman, good to see you, and thank you for bringing this forward. I've been in positions to appoint people to different boards, and it is almost impossible to find people willing to serve. So when you have somebody that's good, qualified, and wants to do the job, that 5-year restriction just doesn't even make sense. So thank you for bringing some common sense legislation forward.
Yeah, thank you. Thank you.
Do we have any other questions from committee members? Seeing none, thank you, Senator Spearman. We will go to testimony in support. I don't know if you have anyone on the Zoom. I'm looking. We don't have that fun wide view any longer. Broadcast Services, can we begin testimony in support?
Testify in support of Senate Bill 123, please press star 9 now to take your place in the queue. Chair, there are no callers in support at this time.
Thank you. Do we have any callers in opposition to Senate Bill 123?
Chair, the public line is open and working, but there are no callers on the line for opposition at this time.
And I think I know the answer, but neutral?
There are also no callers in neutral at this time.
Perfect. At this time, I will turn it back over to you, Senator Spearman, for any closing remarks.
Thank you, ma'am. Madam Chair, this is common sense legislation, and we have people who want to serve. It's just ridiculous that they have to expand the number of years that they've lived here. As a matter of fact, I think one of the greatest strengths of our state is the fact that you have people who are coming in from other places that can give us a fresh eye about how to solve some of our problems. It's common sense legislation, and I would certainly hope that you all would support this. Thank you so much. Thank you for the hearing, too.
Thank you. It's so great to see you, and thank you for bringing this piece of legislation. And with that, I will close the hearing on Senate Bill 123. I also note for the record, Assemblyman Ornlicker and Assemblywoman Benitez Thompson are now present with us today. And at this time, I will open the hearing on Senate Bill 398. This bill revises provisions relating to the Legislative Committee on Child Welfare and Juvenile Justice. We have Senator Ornshaw here with us, I believe, on Zoom. I'm hoping so. Oh, maybe? No? 1 minute? I think that means 1 minute. If we could just take a 1-minute recess for a second, and we'll see if we can get him on.
Thank you.
And I think we can come back to order because I believe I see Senator Ornshaw on our Zoom screen. Again, we are hearing Senate Bill 398. Again, this bill revises provisions relating to the Legislative Committee on Child Welfare and Juvenile Justice. And I will turn this over to and welcome Senator Orenshaw to Assembly Health and Human Services. And please begin when you are ready.
Good afternoon, Chair Wynn, members of the Assembly Committee on Health and Human Services. For the record, James Orenshaw, represent State Senate District 21. Thank you for hearing Senate Bill 398. Apologize for running late. I was over physically in Senate Judiciary, and here I am remotely. I was hoping to be physically present in your committee, but this is the next best thing, and we've made it work so well virtually through this session. Thank you for letting me appear virtually. Senate Bill 398 comes out of the work of the last interim committee on child welfare and juvenile justice. I had the distinct honor of chairing the interim committee during the interim, ably assisted by Assemblywoman Monroe Moreno, who was the vice chair, former chair of that committee. Tremendous staff helping us, Patrick Guinan from the research division, Julianne King, Eileen O'Grady, and Carly O'Krent from the legal division. And we were able to have 2 in-person meetings before the pandemic hit. We met at the Grant Sawyer State Office building with a patch through up here to Carson City. And then after the pandemic hit, we were kind of not sure how to go forward, but with the tremendous help of Legislative Counsel Bureau, Director Erdos, Broadcasting, IT, we were able to have 4 additional virtual meetings and come up with recommendations. One of our recommendations is Senate Bill 398. Senate Bill 398 recognizes how closely the interim legislative committee on child welfare and juvenile justice needs to work with the statewide juvenile justice oversight commission. The statewide juvenile justice oversight commission was formed out of Assembly Bill 472, which I believe was 2017 session legislation that was spearheaded by former First Lady Kathleen Sandoval and former Justice of the Nevada Supreme Court Nancy Seda, to try to unify efforts at improving the juvenile justice system in Nevada. And really, there's a lot of parallels in terms of the work we can do together in terms of trying to help each other and work on legislation to reduce the number of children who end up in the juvenile justice system, and try to make sure that if a child does end up in the juvenile justice system, try to get them the treatment and the help they need, and try to prevent them getting back in the juvenile justice system or ending up in the adult court system. Administrator Armstrong was a tremendous help during the interim in terms of information he gave the committee and trying to answer all our questions. And I know he cares passionately about trying to, meet those same goals of helping children either not get into the juvenile justice system or try to get the treatment and therapy that will help them, get out and not come back. With that, Senate Bill 398 certainly asks for some more information from the statewide Juvenile Justice Oversight Commission and asks them to let us know what their legislative priorities are. I'm happy to answer any questions. However, with your permission, Chair, I wonder if I could go to Administrator Armstrong and anyone else who'd like to speak in support and defer questions after that.
Would you like them to be able to testify in support or be a part of your overall presentation, Senator?
With your permission, if they could be part of the overall presentation?
That's fine.
Great.
If we can go next, I see on my screen, Mr. Armstrong. Go ahead when you're ready. Please remember to state your name for the record.
Yes, this is Ross Armstrong, Administrator for the Division of Child and Family Services. I want to thank the Senator and his interim committee for bringing this bill. For some additional context, as the Senator said, in 2017, the legislature passed a sweeping Juvenile Justice Reform Act. One of the key parts of that was the establishment of the Juvenile Justice Oversight Commission. And they had to develop a 5-year strategic plan. And the current strategic plan really focuses on 4 main goals, which includes evidence-based practices and programs used by our service providers and our government entities, allowing a risk and needs assessment and mental health screenings to help inform court and other actor decisions, collaboration across different child serving systems to meet these needs, and then family engagement plans, understanding that an engaged family is the best way to increase success for a young person. The Juvenile Justice Oversight Commission has made great progress towards those goals. They have implemented an evidence-based risk assessment, which is giving us so much more information about our juvenile justice system and the kids that we are serving, more so than ever before. We've adopted and are working towards concrete and uniform data reporting measures so that we can have even more information. And really what this bill helps us do is it helps set up the second 5-year strategic plan for success. So the current strategic plan is set to expire in 2023. What this bill does is say, hey, let the legislature know before we get to that 2023 session what has gone well in that first year, those first 5-year strategic plans. What do you need maybe some legislative changes for to be even more successful in those second 5 years? And so it kind of helps smooth out the awkward timing of where the session lands and where the plan lands for the 5-year strategic plan. So specifically, this bill requires that the Juvenile Justice Oversight Commission give an update on that 5-year strategic plan and then provide any specific legislative recommendations related to improvement for the next 5-year strategic plan, the disparities, how to address disparities in the juvenile justice system related to race and ethnicity. That's a federal requirement that we've now put into state law to help us make sure we continue to move the needle on that. And then compliance with any federal juvenile justice act. Sometimes the federal Congress will pass a bill and we're a little bit out of alignment. And so are there legislative changes needed to make sure we're in compliance with all those federal requirements? With me, I have Deputy Administrator Catherine Roos and our Juvenile Programs Office Chief Leslie Biddleston that would be happy to answer any questions if there are any. And with that, I'll hand it back over to the Senator.
Thank you. Go ahead when you're ready.
Thank you very much, Chair. James Orenshall, State Senate District 21. And, when the Juvenile Justice Oversight Commission was first formed, I did have the honor of getting to serve on the advisory committee. And at one of the meetings, I certainly will never forget when we had presentations from children who had finished some of the programs at the Caliente Youth Center, our Nevada Youth Training Center in Elko. And we all met and they testified and told us what they thought was working, what they thought needed improvement. And that's certainly something I've never participated in before or since. And it was very, I think, important in terms of trying to shape some of the legislation that you hopefully are seeing in some of the committees this session. And again, Chair, I do believe Catherine Roos, Deputy Administrator of Quality and Oversight, and Leslie Biddleston, Social Services Chief at NDCFF, are here to testify as well.
Perfect. If we can go next to, how about Miss Leslie Biddleston?
Thank you, Chair. This is Ross Armstrong again. We have Ms. Biddleston and Ms. Roos here to answer any questions if there are questions, but there's no additional testimony from them in terms of the bill presentation. I did want to note there's a letter of support from the two current co-chairs of the Juvenile Justice Oversight Commission attached in Nellis, as they are willing and ready and excited about the opportunity to participate in the bill if it is passed.
Okay, wonderful. We will go next to questions. I didn't receive any requests on the chat, but I'm looking around to see if we have any questions regarding Senate Bill 398. Seeing none, it was just such a perfect presentation. We don't have any questions for you, Senator. At this time, we will go to testimony in support of Senate Bill 398. Is there anyone on the Zoom that would like to testify in support? If you would, I would ask you to unmute yourself, state your name for the record, and begin. And I'm not seeing anyone, and I don't have that fun access anymore where I get to see the panel. So broadcast services, if we can now go to testimony in support of Senate Bill 398.
To testify in support of Senate Bill 398, please press star 9 now to take your place in the queue. Caller with the last 3 digits, 377, please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good afternoon. My name is Deshaun Jackson, DASHUN JACKSON. I serve as the Director of Children's Safety and Welfare Policy with the Children's Advocacy Alliance. And the Children's Advocacy Alliance stands in support of Senate Bill 398. We believe it's essential for the reform of the juvenile justice system. Thank you all so much.
Thank you. I don't believe we have any other callers. Do we have any callers on the line in support at this time, broadcast services?
There are no more callers on the line.
And are there any callers in opposition?
The public line is open and working, and there are no callers in opposition at this time.
And I'm assuming the same is for neutral. Is that correct?
Yes, Chair, there are no callers for neutral.
Thank you. I will turn this over to you, Senator Ornschel, if you have any closing remarks.
Thank you very much, Chair. Wynn, thank you, members of the committee, for hearing Senate Bill 398. I personally believe that the more children we can divert from ending up at either local or state correctional facilities is a success. If they can stay at home or stay in the community and receive therapy and treatment. And I believe Senate Bill 398 will go a long way towards achieving that. I definitely want to thank Judge Egan Walker of the 2nd Judicial District, who serves as one of the co-chairs of the Juvenile Justice Oversight Commission since its forming, as well as Joey Orduña Hastings for their tireless work trying to improve the outcomes for children caught up in the court system. And I want to thank Administrator Armstrong, who has worked so diligently to try to make sure that if children do end up at a state correctional facility, they try to get the therapy and treatment that will help them land on their feet once they go home, and also trying to help find homes, because sometimes there's homes not there. So that's often a struggle that he and his division face. With that, I thank you for hearing the bill, and I hope you'll consider moving it forward.
Thank you, and thank you for your unwavering support of children in our state. And with that, I will go ahead and close the hearing of Senate Bill 398. And at this time, I will open the public line for public comment. I don't see anyone in the room, so Broadcast Services, do we have anyone on the line for public comment?
Chair, the public line is open and working, but there are no callers.
Perfect. So at this time, before I adjourn, that concludes our meeting for today. Our next meeting will be on Friday, April 23rd. It will be at the call of the chair. I will try to get everyone out as fast as we can, but we will be hearing some bills. I know that we had several come over from the Senate and were read on first read and referred to our committee. So thank you, and meeting is adjourned.